Hi, everyone, and thank you so much for taking the time out of your day to join us for the launch of Care Through Disaster in Practice, a toolkit for leaders from the citizen to the state. My name's Amanda Kelly. I'm the CEO of Women's Health Goulburn Northeast. And to open our meeting today, I'd like to begin by acknowledging the traditional custodians of all the lands that we're on today. And I want to pay my respects to elders past and present and extend that respect to any First Nations people who are joining us today. I'm coming to you from the unceded lands of the Dja Dja Wurrung peoples, which is in central Victoria. And as I've mentioned, we would love it if you introduced yourselves in the chat, tell us where you're coming from, and also what country you're on as well. And just take a moment, I think, to just be present on your country. We have this beautiful land that we live on, and we have the care and custodianship of our First Nations people for tens of thousands of years. So just taking a moment to appreciate the land that we have around us is a great thing to just take a moment to do. So just to help things run smoothly today, just so you know, there will be definitely time for questions at the end. So if you do have a question, we'd love it if you popped the word question and then asked your question, because I think there's probably going to be quite a bit of chat today, and we don't want to lose any of the rich questions that come through. We do have closed captions turned on, so if anybody needs that, please feel free to use that. And finally, I think you would have been notified when we came in, but the session will be recorded for those who couldn't make it today. So I have to say I'm really excited about launching this toolkit today. The Care Through Disaster project has been the result of a year-long collaboration between Women's Health Goulburn Northeast and Australia reMADE. So just a little bit about both our organisations. Women's Health is a feminist organisation supporting the creation of equal, just and thriving regional communities that are safe and healthy for everyone. We're one of a collective of 12 state government funded women's health organisations across Victoria. We work in health promotion and primary prevention. So essentially, we work to create the world that we want to see. We do this by advocating for a world where not only women and gender diverse people, but all members of our communities live in a gender equal world. Australia reMADE exists to support ambitious, collaborative, and transformative change makers to remake more of the world that we want. They're an independent, not-for-profit, and here for anyone who aligns with their vision and values. Just briefly, I would like to make some acknowledgements, certainly to the Australia reMADE team, a small team of women who aren't afraid to ask the big questions. And it's been such a joy partnering with you for this work. I'd also like to thank both the Officers for Women and Prevention of Family Violence, which are both part of the Department of Families, Fairness and Housing here in the Victorian Government, as they supplied the funding to support this work. I'd also like to thank the team at Women's Health and their commitment to our principles to ensure that we listen, gather evidence and advocate for a more just world. And our gratitude also goes to the professionals and who took the time to engage and shape this work, the people who generously shared their lived experiences of care and its absence through disaster. In this era of climate disruption, unnatural disasters are never far from our headlines or our hearts. The question at the heart of our Care Through Disaster project has always been, how do we set communities up to thrive? No one wants to face a future that is likely to be more disruptive, more marked by risk and fear. However, understanding disaster through a care lens enables us to prepare for crises while building communities that are better places to live 365 days a year. We need to reevaluate the way our societies are organised and resourced, investing not only in the physical and technical infrastructure of disaster mitigation and response, but in community connection and cohesion. In part one of the project, we worked with over over 80 people from the Goulburn Valley and Northeast region in Victoria, each with a different experience of care and disaster. And we delved into two key questions. What does it mean for you to be cared for through disaster? What sort of support do you and your communities need? So that was our first report. Today, we launch the second part of this work, a practical toolkit for citizens and leaders with actionable recommendations for things that can be done right now. This toolkit is an essential part of the project, as our goal is to help people put the care through disaster approach into practice. In our previous research, we learned that what people most need to care in our previous research, we learned what people most need to care and be cared for through disaster, and that is to be seen, safe, and supported. We looked at what that meant to people, things like having a safe and familiar place to evacuate to if needed, as well as access to timely, accurate information on where to go and what to do. So now we take it a step further with actionable recommendations for things we can do now, as well as bigger long-term changes that allow us to really build the infrastructure of care that will hold us through growing challenges of increasing systemic disaster risk. This work brings together place-based experience grounded in Goulburn Valley and Northeast Victoria, as well as some understandings from regional New South Wales and experiences there. And then we bring in national research on public good, wellbeing government, remaking economics, and case studies of emerging best practice. Our Care Through Disaster Toolkit is for everyone. As I said before, it's from individuals, citizens looking to make an impact in their community, to those who work in community organisations, particularly those who work in disaster, but also to all across all levels of government. The recommendations in the toolkit are broken down by these key audiences and layer up. So there may be a category that's most relevant to you, and there's great benefit in checking out all the recommendations. So I'm confident that everyone who reads the toolkit will take away great things to champion and principles to apply in their own communities and spheres of influence. So enough from me. It's now my great pleasure to hand over to Lily Spencer. Lily is the Communications Director at Australia reMADE and has been the main architect of this section of the work. So Lily, I'd like to hand over to you.
Thank you so much, Amanda. Thanks, everybody. It's such a pleasure to be here with all of you. And I'm coming to you from the truly magnificent Gubbi Gubbi country on the stunning Sunshine Coast of Queensland. So my respects and enormous gratitude to the traditional custodians of those particular lands and waters from me today. So wow, care through disaster in practice. As Amanda has already kind of highlighted, taking a care lens to disaster is surprisingly useful. It helps us to see a number of things that I just want to foreshadow for you here quickly. It helps us to take a more collective, long-term approach. It expands our view of what is disaster infrastructure anyway. Is that fire trucks? Is that mass? Is it other things that support community connection and cohesion? It encourages us to take a more relational and less transactional approach, especially with things like education and engagement. And it challenges us to find really innovative ways to better insulate people from the impacts, financial and otherwise, of the growing systemic disaster risk. And so finally, and this will come through in the recommendations, I think it demands that we harness government and the public sector for the public good. And I'll talk about what I think that means to really build the community's capacity to rise to our biggest challenges. So, our recommendations for citizens, because look, we experience the moment of a flood, of fire, a storm, or extreme heat even, really is just mere humans, right? Trying to get through it. And yet disaster prep and survival information, where we'd all be pretty familiar with it, targeting us as individuals with messages like prepare, act, survive, or if it's flooded, forget it. But where we encourage, much less taught or supported, to see preparation as collective action as well. We're getting to know the people around us is seen as strategic, to learn what to do and how to help before disaster strikes. So look, as yes, definitely we need to get prepared. That's recommendation number one. And there are great sources that we list in the toolkit, like the Australian Red Cross, ABC Emergency Online, your local emergency services groups. They help us learn things like how do we prepare our homes, actively shelter in place, when do we evacuate, where do we go, what supplies do we need. We can also learn a lot of this stuff speaking with our knowledgeable neighbors. Then we say, as citizens, one of the things we can do is we can build relationships and capacity. And so, what do I mean by that? I mean literally getting together with the people who live near you to do just about anything that is meaningful or joyful for you. It could be yoga, mentoring, climate action, knitting, rugby. Like, honestly, getting together with people to do stuff that you think is meaningful or joyful, to take on things that you cannot do alone, something that sparks joy will set up that infrastructure, that interpersonal relationships of care that allow care to flow in a crisis, in a context of a disaster as well. And then finally, this sounds obvious, we need to build and maintain ways of keeping in touch. So that might be WhatsApp groups with our people on our street or in our apartment block. That might be telephone trees. That might be wine and cheese nights. We want to share about what we're going to do in the event of an emergency and kind of get to know our neighbors better and enjoy where we live in the process. We are reclaiming the work of community and connection as real work. This is real work. It takes time, and that time isn't frivolous or wasted. This is what earlier generations, especially women, just had more time for. It wasn't necessarily more equitable or valued or funded, but there was time for it. And look, community care and connection still happen through things like schools and clubs and churches and neighborhood houses and cups of tea and chats over the back fence. But making the time to prioritize them is harder than ever in a time of two-income households, skyrocketing costs of living, loneliness epidemics. We are arguing that we can no longer rely primarily on the unpaid labor of women to build, maintain, and care for community. We need into this future new foundations of structural support and enabling infrastructure. So here's an example of a community doing just this. It's in South Hobart, where my beautiful colleague Millie lives, and they run community resilience fairs. They have people sharing cakes and food and vegetable swaps alongside information about disaster prep and even organizing practice evacuations. So I'm going to have to speed up here because we're going to run out of time, but I'm going to try to talk through without talking too much of a mile a minute for you. Community organizations. We heard that many organizations are shifting from seeing themselves as doer of deeds and broadcaster of information to more enablers and facilitators of community-based or community-led actions. It's not that orgs just need to step back and let the community figure it out by themselves, but they do need to shift and figure out how to operate a little bit more relationally and not just transactionally. So the first point on that is, can we do education by conversation, not just broadcast? Because in this day and age of distraction and busyness, there can be all the information in the world and people will still report back not knowing how to prepare and not knowing what to do. But real life conversations still work. We want to make it ultra place-based, sit in a circle, get really local, ask people, what do you know and what do you have questions about? In that learning how to listen, the temptation is to come in and like do and direct. And the challenge is also really learning how to listen and understand because locals want to be seen for their needs as well as for their expertise. And then finally, yep, this all takes time and that time needs resourcing. And there's this paradox here of like the deep, slow work of relational organizing and information sharing is what allows us to move quickly and efficiently in times of peak crisis because we move at the speed of trust. So you need to make and defend time for that organizing. We're saying work to get to know the community in a variety of ways. How does this community function? What are its main gathering spots, languages, networks? So much of this is essential, and yet it could be quite extractive if we had one or two volunteer community leaders who were being hit up by 10 organizations and service providers after a flood. So we need to be really thoughtful and deliberate about this. And there's a model that's getting some traction in Victoria of paid, permanent local community resilience officers who become these kind of key people in the network. And I love this recommendation. Make it joyful where possible. There's enough anxiety in thinking about all of this stuff. The successes we're hearing about is where they do it a good chat over a sausage sizzle, a knitting circle, a community fair, where they get the local fire truck in to visit every street and have a yarn, where they get together over wine and cheese. I'm going to keep mentioning wine and cheese because in this way, the process also becomes part of the solution. So one of my favorite case studies, and we're so lucky to have Mike from Resilient KV here today, is this one right here from Kangaroo Valley. So you can see he shared this with me as a slideshow, and you can see a little bit about this group, and here they are, pandemic spacing during COVID. But this was a group of their neighborhood coordinators. So Kangaroo Valley now has more than 30 bushfire-ready neighborhood groups in the valley. They meet regularly and they stay in touch via WhatsApp. And they're doing all the things that I've been talking about. So how did they fare in the Black Summer fires? The Currawong fire was started by a lightning strike and it entered their community on the 4th of Jan 2020. More people left earlier. No one was killed. There were no local O calls for assistance because neighborhood groups they were organized, they were prepared, they helped and supported vulnerable people to leave early. They made plans for pets and for farm animals. And those who did stay to defend their homes had their names given to the rural KV fire brigade. So the fire department knew exactly who was still there. And the people who stayed all managed to defend their homes and save their homes and then helped each other through recovery. So local government. Local government is also grappling with when to lead and when to follow, and the balance of action on versus action for or action with. And we heard that prioritizing care in local government, so I'm talking about councils here, is a lot like trying to get money for prevention. Like we know it works, but how do you measure it? Who owns it? How do you resource it? It's time consuming. Budgets, capacity, bureaucracy, and so much insurance seem to get in the way. But there's also some cultural barriers around care still being seen as kind of fluffy. So councils can't do everything, definitely, and that's why these recommendations absolutely layer up, but it's a pretty powerful level of government. It's the level of government closest to community. The first thing we're saying is invest in connection. Just whatever you do, invest in connection in the ways that are right for you. People, places, projects. People need time and space to get to know each other before disaster strikes if they are going to be seen safe and supported through it. And, inviting spaces where the lights are on, the doors are open, and the coffee is free. Individuals do need support from government to actually have some spaces, especially if you're living in a rural area. And so libraries, neighborhood houses, maternal child health centers, playgrounds, parks, we all know what these things are in our community. More affordable and community-based transport options, of which we give examples in the report, art classes, festivals, things that bring people together. We also know that local government needs to invest in safety, both physical safety and mental health. So it might not be realistic to expect every local council to provide safe places to evacuate, trauma-informed mental health support, access to appropriate temporary housing. But can councils help ensure these needs are met in a more networked way? So there was a great example of a gym in the Indigo Shire. It gets some funding from the State Department of Education to refurbish. The principal has lived through a bushfire, so she's like, right, I'm going to make this suitable as a community evacuation center. It goes about completely refurbishing it with that in mind. Or there's a council on the York Peninsula of South Australia that directly owns and manages 6 caravan parks that can be used as holiday lets in good times and as temporary housing for people in times of crisis. And there's so many examples in the report of this kind of stuff. And finally, we need to notice when the community is ready. We can't just throw money in programs at the community and expect results if they're not ready to act. But we also heard that local governments are all too aware of the risks and the costs of saying yes, but the risks and the costs of saying no often don't get acknowledged. And so one of the people that I spoke to said, the community are tired of all the blocks that are going to be put in their way if they try to do a good thing. How do we start to push for yes and? All right. I know I'm going fast here, guys, so I hope everyone's okay and with me. Some things local government can do internally, and this is, out of my discussions with local government leaders, instead of just a sort of cost benefit or risk benefit assessment, maybe we can create a care risk assessment. Can we have a true culture and framework of safe to fail where we are encouraged to try new things? And can we learn to recognize when local leaders in the community emerge and enable or get out of their way? And there's a great example doing this in Wangaratta Council in Victoria. The Grid and Resilience Project is a suicide prevention project. They are now training all of their relief center staff and volunteers in psychological first aid so that they will be better equipped to help the helpers and support others in times of crisis and distress. All right, recommendations for state government. State government has a big role to play both in our physical institutions of care and in disaster prevention. And so, one of the things that we are saying is that state need to see themselves as shapers, not just fixers. Whether that's a market fixing or market shaping or community fixing or community shaping. So, we want to address the underlying vulnerabilities. If you are already vulnerable before disaster strikes, you are hardest hit when shocks occur. That is a fact. And so, from the housing crisis to the crisis in gender based violence, we know that we need to do more to address these underlying vulnerabilities. And governments can't just wave a magic wand, but they can much better shape the context in which people are having to make choices. They can measure community well being across a range of indicators, not just the size of the economy. And it's great to see that actually most states and territories now do have some well being indicators in place, asking things like, okay, how healthy are we? How safe do we feel? Can we afford good homes? Can we access good education? Do we feel connected? What is the quality of our natural environment? Do we have enough time? State government can also identify gaps and amplify what's working in disaster readiness. So, um, it's really saying you don't always have to have the money or the answers, but you can bring people together and bring together the different stakeholders to have proactive conversations around disaster readiness response and recovery. Where are we having successes? Where do we have gaps? And we also heard that people want to share knowledge better across borders, but there is a surprising amount of parochialism, and maybe that's not surprising. We all remember COVID and how it kind of became the different premiers in the different states. But it's like, oh, we're not allowed to talk about what they're doing in Victoria if we're in New South Wales. That's considered a no-no, and that's ridiculous. All right. We also want to build trust, cohesion, and agency in supporting communities through recovery. And this really just goes back to how we value and support relationships, because we're hearing from practitioners that we get in communities' way sometimes. And so a lack of transparency or toxic media narratives, or even a political staffer that's more worried about protecting their boss's image than serving the community, can also derail community goodwill and cohesion following a disaster event. So really, this goes back to valuing trust. And we have heard that actually we are getting better at this, which is good. We are getting better at nurturing and empowering people to actually be heard in the process of recovery. So we are arguing that states need to contribute resources, expertise, and information without taking over. There's a great example of this coming out of the Lake Tyers Aboriginal Trust in Victoria. It has a long history of trauma from forced displacement and colonization. There's one road in, one road out. It's prone to fire. And yet, in the aftermath of the Black Summer fires, the Trust has been working with various state agencies to really build some relationships. And they've applied for funding for a dedicated evacuation center, which was described as a safe, relaxing building for a mob where the community can come and feel safe. They've secured funding for a couple of boats. They've been working more closely with the Country Fire Authority to advise on cultural burning practices. So it's a really great thing to see. All right, finally, federal government. So there's a whole lot I could tell you that I don't need to tell you about the climate context and where we're coming from here. So let me just get in straight to the recommendations. We need to move away from private insurance. Right now, there's a Senate inquiry looking at this because the industry's response to the 2022 floods along the east coast of Australia was so bad. We would argue it's not just a case of a few bad apples, but that actually the model is broken. It is described in academic research as privatizing climate adaptation and weakening community solidarity and recovery, and at really increasingly unaffordable rates. An estimated 1 million Australians are already under extreme insurance stress. 75% are concerned that they won't be able to afford their premiums into the future. The Climate Council has predicted 1 in 25 Australian homes will be uninsurable by 2030. And then how do you get a mortgage? So what could be some alternatives? Well, we can redirect the existing fossil fuel subsidies. We can put a tax on fossil fuel exports. We can have further reforms to the petroleum resource rent tax. These and more ideas are discussed in the report as ways of paying for some kind of a public insurance model. We also want to build the capacity of civilian disaster relief, because the strategic Defense Strategic Review last year found that actually relying on the Australian Defence Force is unsustainable in the context of responding to disasters. And so civilians do need more time and training to be able to offer the right help in the right way at the right time. And we need surge capacity, right, from communities when they've been directly impacted. So we do want the federal government to continue to strengthen, resource, and expand existing community emergency, state and community-based emergency services, but we also think it's time to look at the option of a national disaster relief corps because, as this quote demonstrates, people don't know what to do. They don't know how to help. They've never been included beforehand, and when they rock up at the door, people don't know what to do with them. So the community are very unsure about what their place in disaster response and recovery is and the role that they can play. There's a great example here from Disaster Relief Australia, which is a charity of volunteer veterans, emergency responders, motivated civilians. They started in 2016. They now have more than 25,000 volunteers in local disaster relief teams covering all states and territories. And we're asking, could this be the basis of a truly national civilian disaster relief corps? And now we want to harness government for the well-being of people and planet. So that's a pretty big recommendation just to slot in there at the end. But look, this is something that the community wants. So 4 in 5 people want the well-being of population to drive our leaders' decision making. And so what does that mean? Well, to me, well-being government is government driven by purpose, focused on prevention. It's bringing a long-term intergenerational lens to our problems. And there are 3 transformative enablers that government can drive, and that's time, money, and pathways. So we are advocating for a 4-day standard working week as a policy that all of us can begin to push for. And really, this is about getting those big ideas established so that they are there and entrenched when as we need them. So things like a 4-day standard work week, we know that time poverty is actually a barrier to community connection and resilience building, and yet it is treated as this private challenge for market-based solutions rather than a policy choice. But we're seeing trials in more than 21 countries, including Australia. There's a big one kicking off this year in Germany, which is Europe's largest economy, and the Senate's own inquiry into work and care recommended it. Well, a universal basic income also sounds utopian, but it's already supported by a majority of Australians. It's been found to boost happiness, health, and trust in social institutions in trials across the world. And I'm talking about a pretty modest income here. So you can check out the Australian Basic Income Lab for modeling of how it could work here. And then finally, public jobs for the public good. What do I mean by that? I mean, work in disaster preparation, research, community building, but all kinds of work to care and connect and contribute in our communities that you should have the option of a public job that does this. There's plenty of work to be done. And I know the Albanese government is talking about the future made in Australia, which is really giving a lot of money to private business to build jobs in green hydrogen, et cetera. Take that in contrast to one of the things they're doing in the US right now with the American Climate Corps, which they're talking about as a public body that will put a new generation of Americans to work, conserving our lands and waters, bolstering resilience, and advancing environmental justice. Also, Austin, in one of the most conservative states in America, has recently done a pretty wide um, basic income trial, and it dramatically increased people's ability to cover their housing costs, essentially. And it was seen as so successful that they're going to do it again. I'm really running out of time and I'm apologizing for having to speed through this. We wanted to try to get through everything in an hour, but I did have to take a moment to highlight a really special case study. And that comes again from that Grit and Resilience Project in Wangaratta Council in Victoria. So we love this story because we feel like it just brings together so many of the elements that we were talking about. And they didn't wait for disaster to strike. So in April 2022, an art gallery was opened. The mayor was there was a local band, it was joyous, but the weird thing was the walls were blank inside, except for QR codes. And the community could go in and they could scan to sign up to programs to learn various creative skills. Local artists were engaged and paid for by the council to teach. And then as the program progressed, the gallery filled up and the library went, this is great. So they extended the program. So it now has a dedicated Art is in Our Heart room with live workshops, an online program. Community members can come and learn skills anytime. In this instance, government listened and it heard that people wanted to do creative things, but they felt they lacked the skills. Then they figured out a way where they didn't have to run everything. Although, if you ask very nicely, the person who ran it is in this call, and she might tell you about the time the life drawing model called in sick and she was worried she was going to have to run it herself. And then another government community space stepped up to extend the project once it was clear how much people loved it. And, this was supported by a suicide prevention and mental well-being program. We don't have to wait for the floods or the fire to enhance community well-being. Now, this we're going to skip over because you guys can see it in the report itself, which you will all have access to. It's a quick summary of the recommendations for citizens, organizations, governments at every level. And we know that we have covered quite a lot. So I am now going to stop my screen share and pass back over to Millie, who will be able to talk to you a little bit about some of the next steps. She is the Executive Director of Australia reMADE. Over to you.
Thanks so much, Lily. So wonderful to see all of you here. As Lily said, I'm the ED of Australia reMADE, and I also always like to add in that I'm a carer. I'm a carer for my family and community, and I feel like it's important to claim that. Huge credit to Lily and Women's Health Goulburn North East for really driving this part of the project. And a particular thank you to everyone on the call who's actually contributed to this work, and all of you who live and breathe and do this. For me, the significance of what Lily's talked about is that this is a framework that kind of offers us a way to bring together that deep knowing that people have about local communities, but it also raises that up as something worth nurturing and supporting and scaffolding. And it really legitimizes all the invisible work and forces us to ask, I think, 3 questions of ourselves. Does our work unite or divide us? Does it take the long-term view? And does it provide infrastructure that allows us to care and be cared for? Or are we just simply cheering community on from the sidelines and doing none of the support work? So part of what we do at Australia reMADE is to really focus on these broad frameworks of the public good and the infrastructure that's required to ensure that everyone has access to care, connection and contribution. And so to give you a sense of the kind of next phase of this project is actually to roll this work into a bigger piece of work around the citizen and the state and what that relationship looks like, both in good times and in bad. And there was a great question in the chat there actually about, the public service and relational work with community and how we move from kind of quantitative to qualitative approaches, and from efficiency to care. And so I'm really excited that someone asked that question because that's kind of where this work is heading. So an invitation to all of you to get in touch to participate in that. In the context of that project and some of the conversations I've been having, something that has really struck me is when we focus on care, when we look at that as the entry point, the politics seems to fall away. And that's I think it's a way that allows us to approach challenges as people. Care unites us, and that's a really key lesson here. Disaster is coming. We know that, you know that, but so is community, so is care, so is love, so is connection. All of us on the call know this. Our challenge now is to take this work, to take the work that we do and support it, make it visible, show it, use all the mechanisms and power that we have access to create what Rebecca Solnit calls that paradise. We don't have to wait for the disaster to do that. We can do that right now. Somebody in the questions also asked, prior to this, asked how this work might relate to workplace burnout. And I just wanted to kind of note that I would argue it's very much related. Workplace burnout it's something that people experience individually. The disasters we've been talking about are much more of a collective, publicly visible thing. But we need people in our communities, in our workplaces, who are well enough to have the capacity to respond. So we're not facing disasters already depleted. So I think, part of this idea about how we, part of preventing burnout, addressing that collectively is disaster infrastructure. And we can get much stronger altogether talking about that. So Lily has gone through the top recommendations. I encourage you to go through that report in detail, pick a level, but as Amanda said, this all layers up. So, the recommendations for the citizen, if you work in the federal government, you've got to read all of them. So in terms of where to from here, an open invitation to anyone to get in touch. If you'd like a more detailed briefing for your organisation, reach out. Please do share with your networks. If you think there are people who this should get in front of, that'd be fantastic. And similarly, we all actually have to do this work together. We're all colleagues on this. So reach out if you have ideas, want to collaborate, want to talk. So Amanda, I know there's people keen to respond and ask questions. So I'll hand it back to you.
Thank you so much, Millie. And thank you, Lily. It's a big report. There's a lot in it, and I appreciate you getting through it. So that was wonderful. And I wanted to pick up on something. There was a question prior when somebody submitted a question when they registered, just around is this work gendered? How do we look at the gendered implications of this? And Millie really touched on it in her just presentation just then. And Lily has spoken about it as well. This is work that is often not valued. It's not seen. It's not made space for. It's work that women have done for many years, and now in double income households, with the pressures that we have, it gets pushed aside. But it is in fact been seen as women's work, but in fact it's everybody's work. It is what we all need to do. We need to value the work, and we need to think about it as something that all of us as citizens need to do, and not just leave it to the women. So with that, we're really lucky to have some of our people that have contributed to the report here. And we have Mike Gorman, who was mentioned there in Lily's presentation. And Mike is the founder of Resilient KV, with a long history in the rural fire service. And Mike, I'm great to see you on the screen. You've also co-developed a model for engaging community in a form of self-organising in disaster. So I would love to hear just a brief sort of overview of your thinking and how this work fits in with what you're thinking.
Yeah, thank you, Amanda. And yeah, I'm really excited to be here, hearing people talk about caring. Because I'm really a strong believer that this is fundamental to what we need to do into the future. I've spent 20 years in a fire truck as a volunteer, looking through the window through the other sea, which is the chaos sea. And from my experience, that's how we've dealt with disasters, is whether it's planning or the response or the recovery, has always been through the chaos lens. And to the point that I came home traumatised from a fire in 2017 because the level of care was so bad that motivated me at the time as the fire brigade captain to approach our community about what we could do differently. And it was drying out. And when I put it to the community in a public meeting, were they interested in taking a different approach? Interestingly enough, at the end of the meeting, it was all women that put up their hand to say that they were interested to do something different. And that's been fundamental to what we've done in Kangaroo Valley, was to get women involved. And that's normally in the emergency services world, it's very much a male-dominated space. And so the language that goes out to the community is male. And we managed to take a caring approach to that in Kangaroo Valley, and the women were critical in that, in engaging and having the conversations. And I think having those conversations is absolutely essential if you want a different response. And it's something that I found very deeply in the Royal Commission report into the Victorian fires in 2009. Someone actually made the comment that we need to change the conversations and make them real. And that's what we managed to do in Kangaroo Valley. And I think by being game enough to have real conversations with people rather than just telling them, you should do this, you should leave early, or you should have a bushfire plan, we turn that around to actually helping people and engaging on a more one-on-one or at a street level. And by taking that caring approach, we had a totally different response come the big fire. And we were smashed by a massive fire on a catastrophic day. And for New South Wales, it was most probably as bad as it's ever been. And in spite of that, we had, not only did no one get killed, we actually had no one needing medical assistance. and no one asking to be rescued. So we were actually caring for the volunteers because we weren't asking the volunteers to do dangerous and stupid things, because we had cared enough about people ahead of time. And so, yeah, I think the thing that we demonstrated is that taking the caring approach actually makes a massive difference, even in the absolute worst conditions. And that's certainly the message I would like to get out there to the rest of Australia. Thank
Mike,
you.
thank you so much for that. Well, first off, thank you for the incredible work, and for, I think one of the things that you just said was we need to do it differently. And you know, when we keep trying it the same way, we get the same results. And you've demonstrated this different way of working that is, you know, fantastic. So thank you. Really appreciate your input into this report as well, and people can read your whole case study in there. But Mike, thank you so much.
Thank you.
The other person that we have with us today that was mentioned in Lily's report was Sally McKay. Sally is a specialist in disaster recovery and humanitarian diplomacy with more than 25 years experience in humanitarian aid, disaster recovery, community development, disaster preparedness and resilience building initiatives across the Pacific, Asia and New Zealand and Australia. Sally, thank you first for your contribution to the work, and I would love to hear your thoughts on the work.
Look, I'll just be really quick because I think the value is in those questions. I just want to say thank you for the opportunity to participate. And I think you've set yourselves up so well as a good reflection model, you know, and you say in the report, you know, we're not emergency management specialists. And I think that's the beautiful part of the reflection. We often do reports from the emergency management perspective, and taking it away from that and bringing a fresh look at it and working on what's happened in the past. And I am biased, I'm an old feminist, so I do like the feminist lens applied to it. So thank you for the work you've done and the recommendations you've come up with. I think in the current context, they're really valuable, and they're really valuable to read through and to understand them and to see how we can help enable those changes to occur. So I'd just like to sum it up at that I think this was a good point of time of reflection. I'd certainly be promoting this work, and I think it helps those conversations go forward. And as Mike was saying, it's about when the community are ready and how to enable and support them to put these practices in place from community level up to federal government level. But I think you've shown a lot of capacity to listen, and you've been very authentic and I think very brave in putting the recommendations forward. So that sums me up, and I'll leave it for the rest of the floor. If anyone wants to reach out, they're very welcome to. I don't go away in a hurry, I'm still here. So thank you for the opportunity.
Thank you, Sally. Thank you so much. And, you know, for the work you do and for your input into this. I think that, you know, as you've said, we need to reflect together, and you know, this is the part where we can make the changes. And one of the questions in the chat actually was about how can we think about you know, where we seem to have more time pressure, we have more quantitative reporting that we need to do, and how do we work with that, and how do we change it? I think by doing it. I think we need to change it by having these conversations, by deeply reflecting, by working together and getting out and doing it. So Mike showed us that, you know, that he just got up and did it. And, you know, and this is the work that we need to do. So thank you, Sally. We have Beck Nash Webster with us, who's not feeling very well at the moment, so we won't put her in the spotlight. But I did want to just say that Beck's contributed to the report, and she runs the Grit and Resilience program with the rural city of Wangaratta, and is looking to see how the report can be used within the rural city of Wangaratta. Just a reflection from me, I was in Wangaratta when the bushfires were happening in 2019, and the Wangaratta Council did a fantastic job with their evacuation centres that served right across the region. And so this work that they're doing now they were really great, and they're looking to see how they can improve them, which I think is fantastic. We can always think about how we can do these things better. And so, yeah, so thank you, Beck, for your contribution here and the work that you're doing as well. So I think that we're up to questions. I know we've got about 13 minutes left. I will let you go at 2 o'clock, everybody. But we have some questions. So Millie, I'm just wondering, or Lily, but I think Millie, you've been looking at the chat. Is there anything any questions that you want to highlight for us, and then see how we can respond?
Yeah, thanks. There's some really good questions. So I'm going to combine, and some of these questions come from registrations. So hopefully these people are on the call. So I've got a question from Olivia and a question from Sam, and I'll combine them. So Olivia's question is, what is the most effective way we can achieve systems change to increase equity for all? So like a small question that I'm going to throw to you, Lily, to answer. And Sam's question is, how do we impact those at the top of the hierarchy who see their interests as best served by the status quo? And Amanda, I mean, you feel free to answer both of these questions as well.
Lily, I think that you could probably solve this in the next couple of minutes, couldn't you? If you could answer those, that'd be great.
Oh my goodness. I mean, I love those questions so much. And I think we all spend our life's work trying to solve them. Certainly, that was one of the reasons Australia reMADE was created, was really to look at how do we do systems change. And so there's a blog that has just been put in the link in the chat where I wrote kind of a primer to that, and to thinking about if the system is an iceberg, with the observable event at the top and then the paradigm at the bottom and everything in between. Thinking about, okay, well, what is my work to do? Where can I effectively intervene at different levels of this iceberg? And this article takes through some ideas around how we can start to take a step back and look at, okay, if I can't do everything, or, maybe even one thing, well, what would that sort of look like? And I think, as individuals, really conversations like this help us start to look up, right, from symptoms to sources, that there is no one role to play. There's no one right way to be a change maker. We have everything from, laws don't suddenly just change, right? There's arts and culture and so many elements that go into shaping the paradigms that people are coming from. And so we can be the people of both, and, you can bring your keep cup and you can advocate for, a tax on fossil fuel exports, or, it's like there's so many different ways that we can do this, but it requires us to be who we are fully in service of something greater, not to feel like, well, I don't have a role because I'm not the perfect activist, or I'm to this or not enough that. It's really looking at, well, what are my networks? What are my skills? What are my strengths? And as to that question of how do we get the people at the top to care? I mean, again, a brilliant question. And I know that there's been work shown that, civilizations have collapsed because by the time the problems got so big, Jared Diamond's work on that front, by the time the problems reach the people in the top, it's too late to do anything about it. I think it's all the things that all the movements that all of us are working on are aware of, the combination of the carrot and the stick of appealing to enlightened self-interest and seeing the rise of things like, the businesses and the people in formerly safe coalition seats who are changing their vote on the basis of climate action. We need all of it. I guess that's my short, messy answer, is we need all of it. But I encourage you to dig in further to what bit of that is yours to do and who you can do it with.
I just want to add a tiny bit to that, Lily, because yes, yes, yes to everything you just said. And I think that it is just so important that we do the thing that we can, and that we don't try to be perfect and we don't collapse under the weight of it, that we reach out to each other to work together. I think that if we try and do this stuff alone, we fail. And so this is really important to collect together, and to be a community in this. So Millie, more questions. These are great.
Yeah, they're not easy. What have you found, and Amanda, this might be one for you to start with, but what have you found effective to gain traction for an ethics of care when working with different levels of government. And I forget who asked this question, apologies, but they say love as language has been mentioned, but what about sort of different paradigms and discourses that funding, grants, policy, etc. are written in?
Yeah, thanks, Millie. Again, another really easy question, so I'll be able to answer that
Go
in
for
3
it.
seconds. I think that Lily touched on it. We need to be authentic. We, the people that we work with at different levels of government, in different aspects of our lives, they are people who are here and having experiences like us. So I think that one of the key things is to find common ground. We often focus on the differences or the problems, that, this grant is asking for this, and but when we look at, well, what do we actually want to achieve? We want to achieve many of the same things. We often get there through different paths, but we want to achieve many of the same things. So I know that sounds like a very broad answer, but really it's an approach to take to approach people with our commonalities in mind rather than our differences. So that would be my response. Lily, did you want to add anything there? No.
I think that's great, Amanda. Thanks.
Thanks.
Shall I find another question? Someone's asked whether, Lily, this is a question probably for you, Lily, do you have an example or a template of a care/risk assessment? Or maybe you want to talk a little bit more about that. You mentioned it in your presentation.
Oh, that's such a great question. And no, I do not, unless I know Kate O'Toole. I'm going to totally put her on the spot now. I know Kate O'Toole is here from Indigo Shire Council, and I don't know, this is an idea that came up in one of our discussions, and I'm not sure if it's something that people would be game enough to go away and implement, but certainly like you would get endless accolades from me to be the first person to create one. I think it's just the notion of like, what is the risk of saying no? What is the risk of communities feeling unheard, disempowered, when they're trying to do a good thing and council's like, oh, sorry, So Kate, I'm totally putting you on the spot massively unfairly here, but just because you're the person that I discussed this with in part, do you have anything that you want to add to that?
It's look, I mean, I'm game. I'm not quite sure how to even take that on, but it's not the first time and not in the first way that this has came up for me throughout my work and throughout the variety of community organizations that I'm involved with. So yeah, I mean, I've probably spent a bit more time working on it within the LGBTQIA community. So, and the dangers of not, particularly in the last year. So I've spent a bit more time thinking about it there, but haven't quite got to a point of progress, but I'm looking for a new project. So
there's the challenge. And also, to Beck, who was mentioned earlier, like I would love to see where this goes. And if people do have examples of that, I'd be happy to share them around later on with anyone who wants to see it or co-create it together, because it's such a good thing.
Yeah.
Thanks for rising to the challenge there, Kate.
Yeah, thanks, Kate. Sorry.
Do you want one more question, Amanda, or are you?
Look, we've got 4 minutes. Yes.
Okay.
Go for it.
Someone just asked, which I think is a really important question, about what were the contributions made to this report by Aboriginal and Torres Strait Islanders. And I can certainly just answer that as a chime in for the first part of the report, is that we know that that's a group that is like over asked again and again. And so we did a lot of outreach to those communities and invited them in. I'm fairly confident Rachel had some conversations. She ran the first report, but one of the things we really made an effort to do was to go through, where have these voices already spoken? If they don't want to come to this particular conversation at this particular time, where have they spoken? Where are we listening to what has already been said? So there was a real effort to go to those places where the stories are already being told, the perspectives already given, and integrate it into this work. And the person who asked that question referenced the caring about care report by Aboriginal and Torres Strait Islanders, and I really will put it in the chat as a really important and significant piece of work around care from an Indigenous perspective. Amanda, you might want to respond to that as well. And there are examples in the report, Indigenous examples through the report.
Yeah, I was just going to say I learned some tremendous things in some of the research for this. So I can try to pop some links in the chat quickly, but I know people have to go. But organizations you might want to Google include Fire Sticks, which is a nonprofit working across Australia to promote cultural burning practices and fire management. The Northern Rivers Community Healing Hub, which is based in the Northern Rivers, and it has trauma-informed counselors, body workers, weaving circles, yarning circles. So it's a self-organizing network run by Indigenous and non-Indigenous community members. And there's also a really beautiful example from the federal government called the Empowered Communities Program. And that's Aboriginal leaders from across Australia working together with government and other stakeholders to shape how policies and programs are designed and delivered in really diverse Aboriginal communities. So it's going beyond consultation to really place-based community-led partnership. Those are just a few off the top. There's plenty more you can find out in the report.
Thank you, Lily. Thank you, Millie. That's for rallying all the questions, and I think it's time to wrap up now. I could keep talking about this for days, but that's the invitation, please, to reach out to us. As Millie said earlier, if you would like us to talk to your organisation more closely about this, if you'd just like to reach out because there are projects and things of interest, but please do read the report. It's just really rich information in there, and we hope that it will inspire you. Before we go, I just want to thank Catherine and Annika, who have been working really hard in the background to keep everything running smoothly. I also want to thank Rachel, previous Australia reMADE team member, who did an awful lot of work on our first report, and to Lily, who's really driven the toolkit. Thank you so much, Millie, for your beautiful steering of the ship as usual and your wisdom. And thank you all for being here. Thank you for being part of it. The conversation doesn't stop here. The work doesn't stop here. This is just the beginning. So thank you all for spending the time with us, and goodbye.